Good day, everyone, and welcome to the DRI Resilience Summit. I'm Raelene Anderson, and I'm the Business Resilience Manager for Delta Dental of California. And today we're going to be sharing a case study on our four-pillar journey to total protection. The four pillars for business resilience include business resilience, which was rebranded from business continuity, crisis management, emergency response, and workplace safety. Joining me today is Bobby Cook, also a manager within our business resilience management team. A little bit about Delta Dental. We are a nonprofit organization with about 3,600 employees. We're the leading oral health benefits to more than 40 million people in its 15 state and District of Columbia operating area. We have offices located in San Francisco, California, which is our headquarters, Oakland and Rancho Cordova, which is near Sacramento, and Alpharetta, Georgia, and Mechanicsburg, Pennsylvania. So the foundation of our program really lies with workplace safety, and it's the forefront of everything that we do. So we will talk a little bit about the journey, how we are going to be getting to the place that we want to ensure that we have a healthy and safe work environment for all of our employees. Emergency response, 0 to 1 hour for all types of events, whether it's natural, man-made, or technological. If the emergency response goes into extra innings, then we would activate our crisis management pillar. If that is, then we would move into our business resilience organization. Next slide. So here is the team that we've assembled at Delta Dental of California. Terry Chapman is a longtime Delta Dental employee. She's been with the company over 28 years, and she brings a lot of knowledge from the business into the business resilience team. She's a certified business continuity planner, a past president of the Association of Continuity Professionals, the LA chapter, board of directors for Business and Industry Council for Emergency Planning and Preparedness. My co-speaker, Bobby Cook, is in charge of our crisis management and emergency management and safety. He's also a certified emergency manager and business continuity planner. He has a master's in security management and a 25-year firefighter and 911 responder for the World Trade Center. And filling out the remainder of our team is Nell Lee. Nell is our business resilience and emergency management and safety professional. She has associate emergency manager and associate business continuity planner. She has a master's in disaster medicine and management and 15 years in emergency medical services. And we report to the director of the people experience, and I'll share that journey when we go into the next piece. Next slide, Bobby. So I'm going to present just an overview of all four of the pillars and the evolution of where we started and where we hope to be in 2023. So I was hired in December of 2019. And after an internal audit, the business continuity piece was taken out of the technology group and moved into the people organization. So we had some rebranding that we needed to do and developing the pillars and the assessments of the programs for a roadmap for 2020. It was a very aggressive roadmap. And so early in 2020, we hired additional personnel, built our four pillars with roles and responsibilities, developed the framework, operating model, governance, and stood up our steering committee. And the rebranding really was important because most people associated the business continuity program with the technology DRI. And so we really needed to pull that out and really make it more visible. And then, of course, as everyone knows, COVID-19 happened. And even though we did have a very aggressive 2020 roadmap, we were able to effectively manage that and the pandemic at the same time. My team was responsible for developing the pandemic plan, standing up the pandemic management team, and monitoring everything from CDC requirements to our own internal processes. In 2021, we just redesigned their internal portal for all of the pillars and added a new section for COVID-19. We facilitated quarterly steering committee meetings. And of course, we continued to have our COVID-19 response. We developed procedures, processes, and training because we had fully anticipated that we would be coming back into the offices in the June, July, August timeframe in a phased approach, but that didn't happen. So, but we do have all the training that we did and still can put it into play should we need to. In 2022, we have been really just focused on strengthening our programs and looking at what we have within each of the 4 pillars and adjusting as needed. We have come to realize that we have to start planning for a new normal. We had anticipated having 100% of our employees back in office in the late 2021 and definitely by 2022. We now currently have only about 1/3 of our employees back in office. A number of folks have been coded fully remote, and many are now on a new hybrid schedule. So that really changed some of the ways that we had to think about our program. We're hoping that we will be able to start phasing out all of our COVID-19 response. So it's looking good so far. 2023, we are really going to be aggressive in developing more comprehensive training and exercises. The company as a whole had done very few exercises outside of technology. So we're really wanting to bring some robust exercising across some of the pillars. We want to validate and review all of our existing metrics for all of the programs as well. Next slide. So for the next several slides, we're going to be breaking down the progress that we've made within each one of the 4 pillars, starting with business resilience. So in 2019, as I mentioned, Terry is a 28-year employee with Delta Dental. So there was only really one person working on business continuity. We had 50% of our plans and strategies that were current. The rest weren't. They were at least the highest priority processes. We had an antiquated business resilience tool, and we were doing manual feeds into all these systems. It would take Terry anywhere between 8 and 12 hours to do those manual feeds. In 2022, we really started working on the foundation for the business resilience pillar. And a lot of what we learned from our response to COVID-19 was instrumental in the redesign of our program. And let me give you a couple of examples. In plans that we had previously, we took a lot of time in figuring out, individual equipment and, working from home. And a lot of the information that was gathered really wasn't relevant or necessary. But what we found is that we were not capturing information that we should have been. And so it was really important when we looked at how we wanted to restructure the program. We also went on a hunt for a new business resilience tool and started automating our feeds into the legacy systems that we had. In 2021, we worked with a new vendor to customize a new BR tool. And from the get-go, we automated the feed into that new tool. We began the transition of our BIAs and plans into the new BR tool. And this is something that has been a little bit of a challenge because we're still updating plans in the old tool as we're transitioning new plans into the new tool. And then we also maintain all of our legacy systems. In 2022, we rolled out the new BR program and the tool for everyone, validated and modified our policies and procedures, developed and implemented maintenance and audit processes, and we're beginning to incorporate our state and federal programs into our BR framework. Previously, the company had siloed out the state and federal programs, but we feel that it's important that we are together as one cohesive team. So we're bringing them on board along with the commercial. 2023, we want to have full implementation of our new tool, comprehensive partnerships with all of our personnel for better response and recovery, and then 5-year training and exercise development. And as always, we continue to validate and review our existing metrics. I'm going to turn it over to Bobby to talk about crisis management and emergency response.
Thank you, Raelene. Thank you all for joining us today. I was hired in the very beginning of 2020, just after they announced COVID had reached a level where we had to take notice to it. So the first thing we did was looked at the program as a whole. And they had an enterprise-wide program. That means if they wanted to close the site in Pennsylvania for an ice storm, they were waking people up at 3 in the morning in California, getting people on the phone from Texas. It took a lot of time to assemble people. And then, people in California, were not really participating because they didn't understand, they couldn't see it, they couldn't feel it. So we went to a site-based model. We did all the roles and responsibilities, and we empowered local leaders to actually get their team together and make decisions. And this was on the weather-related, it could have been, workplace violence, it was anything. One thing that we've done is taken a piece of the playbook from FEMA. Is we handle everything from a all hazards approach, but we have to tailor certain things like pandemic response and things like that. But for the most part, we use the incident command system, ICS, to run our calls. So once we got done figuring out who was going to be in charge of each site, which was mostly a senior vice president, we allowed them to pick each of the person on their teams. And we placed them in roles in the people organization, the HR function, communications, all the way up to legal. And our structure was able to grow. So if something affected a region or actually the whole company, we would kind of grow into an enterprise level response and have meetings to discuss how this affects the whole meeting. And if need be, we would be able to call in the senior leadership team. So that escalation, which we began in 2021, worked really well. Where we really focused was training. And that was having everybody understand what their roles were at time of disaster. We kind of shied away from checklists because we wanted people to know what their jobs are automatically. A very basic example of that is if something happened involving one of our buildings, facilities would automatically check certain things and have that report ready for the leader to disseminate out to the whole team. So we really focused on site team trainings and position training. And we know that most crises begin at the local level. And while they expand, they pretty much stay at the local level. So there was no more waking people up at 3 o'clock in the morning who probably didn't care. And we put some automated systems in all the way down to the mailroom. That the mailroom, the incoming mail, and we get a lot of mail as an insurance company, would be diverted to another site or held for 24 hours in the case of, let's say, an ice storm. Most of our incidents are announced, if you will. We know the ice storm is coming. We know the hurricane is coming. We know those type of things are coming. So we have a couple of days to prepare. Where we really used our quarterly exercises are for the more acute things, like an earthquake, perhaps an active shooter, any type of thing like that. Because we felt if they could handle those type of events, then the other ones would be pretty easy. So in 2022, we reviewed the teams list to make sure that we had the right people in the right roles. We cross-trained some of them just in case those people were out. We had backups to every position, and the quarterly exercises became more complex. So as people joined in, whether they were new or not, they came together as a team, and that was really important. We also have just completed a senior leadership procedure and almost complete on our exercise for them. We realized that on really bad acute situations, they really haven't had, luckily, had to use any kind of training or exercise for that, but we want to make sure that they're ready and hopefully we won't get any events. So we've responded quite a bit over the last couple of years, and as Raelene discussed, the COVID response was massive. So we'll talk a little bit about that in the next section. 2023 is going to be big for us because we're incorporating our state and federal programs into our structure. Certainly they had things in place prior to that, but one thing that we've done with whether it's safety or business continuity, crisis management, emergency response is what we call consistency. Everybody gets the same training, everybody does the same process and procedure, and that's by design. This way, if somebody is at one site and has to get involved in another site, we've all been trained the same, so we can all respond the same. So we're going to continue to make some creative exercises, and they're timely. So if we see something happen at another large corporation, we may see how that plays out at Delta Dental. We're also hoping that we have enough people back in the office where we can do a full-scale exercise with the emergency response team and the crisis management team, as well as the business continuity team, and just see how it all works. As we move to emergency response, this is really my wheelhouse, and this is something that, you know, the whole team is really passionate about. We again looked at the program that they had. It was pretty inefficient. Nobody was watching over it. The equipment got outdated and stale. So once we started looking at it, it was a complete redo. Now we know for a fact that the national average for emergency responders from 911 to arrive actually at your building, at your patient, at your alarm is anywhere between 8 and 12 minutes. In the cities, it could be a little bit longer. And we know that if we have certified people, they can be working on a injured or ill person within 1 to 2 minutes. So we came up with a new structure. As Raelene had said, Nell and me and Raelene have worked together at our previous company, which was a multinational company. So we had some really good experience getting remote teams up and running. So Nell and I are both certified instructors, and we started certifying people in CPR, AED, and first aid. And within about 6 months, we had certified about 70 on-site personnel to respond. We taught them incident management. And then we went to really certify everybody in bloodborne pathogens because we just wanted everybody to be really smart about that, and trained well over 100 people. We came up with a budget, we came up with equipment that could be used, and in the beginning of 2021, we actually made that purchase. In addition to making the site equipment purchase, we also purchased all new automatic external defibrillators, AEDs, because they were quite old and they can't last forever. We continued to recruit people, and like I said, we have about 70 certified team members throughout our major locations. And the other really cool thing we did is we borrowed another page out of the FEMA playbook, or DHS rather, with ready.gov. And we made our own so that we could put things on our website where people could go to and see things that were pertaining to them. So if you want to know what to do with barbecue safety, all the way to hurricane safety to earthquake safety, that's where you'll find it. They can ask questions and we'll give a response. So all these things upped our game, not only on the emergency response level, but as Raelene said, our foundation is workplace safety. So they could find all the information that they need. In 2022, we added additional team members, and we scheduled more courses coming up. The big thing that we were missing was in on-site communications. And that was, how do we get ERT notified that there's a problem? How do we get security to know that we're responding? And how do we let people know we're coming? At the same time, you know, 911 needs to be called in most cases. So we had to come up with an on-site communications program. Initially, we were looking at a third-party dispatch center, but when COVID hit, we had to change our focus to COVID response. Part of our area responsibility was doing entry screening. We had to do the tracing of all of our members that were either infected or, came in close contact. And we had, big list, little list, like many of you. We had a lot of people that were involved, and then not a lot of people, and then a lot of people again. So together, we took all of our 4 pillars and made that response very effective. We are also working on our floor warden program for evacuations to ensure that our people are swept out efficiently and gotten to the assembly areas, and that will also be an ERT function. We had to wait on that because we didn't know who was in the office, who was coming back. As Raelene said, we lost quite a few people to permanent work from home, as well as people that went to a hybrid schedule. But now that we have a pretty good handle on who's in the office and who's coming back, we'll be able to, for lack of a better word, deputize them into the floor warden program. As far as the post-COVID-19, which we're not quite there yet, that's going to require some, kind of retraining on some things, because that's been our focus. What we're looking for in 2023 is to train some of our members in more advanced first aid response. We are going to be looking at incident management on a larger level, and that's through incident management training with people automatically going to their post and doing a job without having to be told, all folding into the site incident commander. We're going to start doing exercises for emergency response. And then, of course, we're going to integrate that with our crisis management team, our business continuity team. And, the bigger we get, the better we'll get. And then we're going to revisit our integration of our new offsite emergency call-out response. And then it'll be time to recertify everybody again. So we're taking this really seriously. We have even, and Raelene will talk about this in a minute, we've looked at safety from people working from home, because they need as much education as people who are working in the office. Our job is to make people safe, and when that's not possible, that we respond efficiently and quickly to help them. So I'll turn it back over to Raelene.
Great, thanks, Bobby. So the safety culture at Delta Dental, when I came on board, and as Bobby and Nell and Terry know, the safety culture was almost non-existent. There were multiple groups that were managing safety, but it was really not being well done or well managed. And so we really wanted to take a look at that, because that is the foundation of our entire program. So the workplace safety program that we have implemented meets all of the requirements for Cal OSHA, and actually exceeds some of those expectations. The other thing that we wanted to do was do a very comprehensive assessment of the facilities themselves. So looking at, what does the safety culture look like from an audit perspective. So we were able to do these inspections and completed some corrective or asked them to complete some corrective actions for us. In 2021, one of our senior leadership team members offered to be our executive champion for safety. And that went a long way, because he was the VP of operations, which is the lion's share of our entire organization. And so he helped us roll out the Safety Champion program. The workplace safety training that is required by Cal OSHA was also not being done on a regular basis. So we completely reworked the entire workplace safety program that is a requirement for all employees to take on an annual basis. We followed up with the individuals that we had sent the corrective actions for in 2020, and did site visits to ensure that these actions were completed in 2021. And then we also relaunched a brand new safety website that Bobby referenced, Delta Dental Ready, and it very much mirrors ready.gov and a couple of other types of sites. But it's a really important place for people to go to for information that's specific to their area. We really wanted to rethink or look through a different lens on what workplace safety means. And by that, we talk about who is in office versus who is permanent work from home. And so we really wanted to try to do something for the individuals that were working from home. So we created a work from home safety training program as well and launched that in 2022. One of the areas that we wanted to focus on because of the nature of the incident and the impact was workplace violence. And we wanted to look at it in a couple of different ways. We didn't want to focus on the response portion, but mostly on the awareness and prevention. So we wanted our employees to be able to look at a situation and determine if it's something that they needed to escalate to people relations, their manager, or even to 911. And so we really did a great job working with our learning development team in putting this program together. It is also a required course for all employees on an annual basis. Included in that is we previously did not have any established safe rooms. And this was important because we do have some of our locations that are in tornado areas, as well as all of our locations could be subject to a workplace violence incident. And so we reworked all of the evacuation maps, and it was, a lot of work done by Bobby and Nell and the facilities teams to get that done. But the safe rooms were important for every reason, for the workplace safety and for tornadoes and such. We are looking at relaunching the Safety Champion program again with a different target audience, knowing now better who's going to be in office full-time versus remote work. In 2022, we are going to start working, or 23, I'm sorry. We're going to start working with our Total Rewards group, which is in the People organization. They're responsible for managing our insurance for work injuries. And so we want to work with them to find out the type and of things that we can reduce those injuries. Safety Champion, we're going to continue to grow that. And we're hoping that we can have safety as a culture adopted by all personnel as soon as we can. Continuing on with our workplace safety program, we wanted to give you some examples of what the work from home safety training looks like. So I'm going to turn it back over to Bobby Cook, and he's going to take you through a portion of our work from home safety program.
Thanks, Raelene. Our mission at Delta Dental is to keep all employees safe, to prevent injuries and illness when possible, and to inspire a culture of safety. But that doesn't have limits as far as only in the office. And that's one of the things with our emergency response team is they can use what they've learned at home, houses of worship, the supermarket, and the gym. And Raelene and I have actually a documented record of some of our team members saving people's lives outside of work based on what we taught them. So with all this new hybrid work or people being coded permanent remote, we want them to be smart and safe as well. One of the first meetings that I attended was a workman's comp meeting, and I heard some of the things that were happening to our people, both at home and in the office, and I felt like we could do better. But the insurance agent was telling us about other things that he's seen over the years not related to Delta Dental. And one that came to mind was somebody got hurt standing on a counter trying to change a light bulb in their home office. And that was quite costly to the company. So we kind of came together as a team and figured out, how can we make people safer at home? So Nellie took the lead on this. And I just want to give you some examples of how we did this at home. First, we looked at the workspace. We found that people were working on children's desks, they were working on their counters, rickety chairs, all sorts of things. And the big thing is that a lot of people don't have the room, especially if you look in the Bay Area. Apartments aren't very big, it's just the nature of the beast. So we wanted them to have a proper setup. And even me, I work from home, and I could tell that my wrists were starting to hurt, my back was starting to hurt. So I called up our people in charge of ergonomics. They gave me some tips. 2 years later, I'm doing great. But you have to declutter little things like that because we all eat and drink at our desk, so this could happen in or out. But spilling things are bad. So we wanted to make them aware. Temperature controls, all the little things that might cause them problems later, and ultimately are workman's comp people. The biggest thing that we see both in and out of the office, which we've really gotten ahead of, is what we call daisy chaining, because people don't have enough power. So they're plugging things into to outlets that were overloaded, or they have extension cords going across their room they could trip on. So we wanted to make them aware of that. And the big thing is when you're sitting at home, you may have the TV on in the background, you're working, and you forget to get up, because there's no more social situation where you get up to talk to somebody who might be in a cube a few doors down, or you want to go talk to your boss. You're constantly at that computer. So we need to remind people to get up. Delta Dental has a fabulous wellness program. And it's really fun because sometimes there's challenges. Every day at 12 o'clock, you have to walk for 5 minutes, and it goes into a system to track you, or they have how to eat something or cook or whatever. So they're way ahead of this than most companies. The other things that we look at are, home safety. We want to give people some statistics. We want them to know what they're looking at, just to spark them and say, hey, you know what? I do have a 5-year-old at home. I can't watch them at all times because I might be on a meeting. So we want to take extra precaution and put medications away. We want to make sure that our extension cords are not across the floor. So when the visiting grandmother comes into the office, she doesn't trip on them. It's little things like that. So we're trying to keep people safer at home. We talk about getting a fire extinguisher and placing that properly. All these little things go to an increasing safety culture, and that's really pretty important to us. So to get a little more in the weeds about emergency response, we typically have, just a few type of responses, whether it's an evacuation due to somebody pulling the alarm, a drill, or a malfunction. And a medical emergency is really our big one, and hopefully never a workplace violence where the police have to respond. But we've trained our team to take certain positions. Every one of our medical events will have a incident commander who will be pretty much out front. And then when we wait for the fire department or the ambulance to respond, we'll actually have people waiting for them and other people blocking the aisle until we can get that direct hit. What happens is in a lot of companies is the fire department will show up and either A, nobody knows that they were called, or B, they're not exactly sure where the patients are. So what we try to do is to have people ready to escort. It's just that simple. It takes several minutes off the response time, and in medical emergencies, every second counts. So we've made that process really streamlined. And it doesn't even have to be emergency response members. You can just ask anybody, hey, go wait by the front door. Please hold that elevator. Please keep everybody out of the aisle. The whole thing is to train people that they might be called into service. And that's why we spend a lot of time sending out emails and doing electronic billboards, even regular old time, push pin in the paper billboard to let people know how they can help. We have our typical evacuation, which again, we start at the middle. There's only really, think of it like a pitcher and a catcher. The sweeps are the pitcher, the assembly area manager is the catcher. And what we want to do, oops, sorry about that, is we just want to start in the middle, sweep everybody out, check the cubes very quickly, check the bathrooms, offices, and get them out the door. The big thing is to put people by the door so that people don't come back in. And over our careers, we've heard all sorts of stories of people stopping for coffee, to get their lunch. The big thing you got to remember is when everybody's outside, if they can't go back in, let's say there's a gas leak or something like that, you really want to teach them to take their stuff with them, even if they're going to a meeting. Because let's say we have to close the facility from, let's say, an earthquake. The building's cracked, nobody can go back in. There's a workplace violence thing. It turns into a crime scene. People can't get back in, and that's a problem. So what we want to make sure is that you tell people as a reminder, as a safety reminder, take your stuff with you, the bare minimum: medications, keys, ID, wallets. Everything else can be gotten later. Raelene would argue with me, take your computers, because replacing them to work from home for a few days could be problematic. The big thing is that everybody should at least have some basic education on what to do for an evacuation. Once people are in the assembly area, keep them posted, because after about 15 minutes, they will get restless. They will start driving around the parking lot. They'll leave. They'll go to your other buildings. So we really want to have this kind of discussion. For medical things, set it up before. Again, you have your patient, you have your first person to make sure that the scene is safe. You don't want to send people into a situation where there's a light fixture hanging, or there's water, or there's not room to move, or the cube wall moved, or things like that. And have that person in charge who's directing people. Always have, somebody grab on to the patient immediately. That's the whole point of emergency response, is to get somebody on them within 1 to 2 minutes. And we teach them what questions to ask, what to look for, signs and symptoms. They get more help. The big thing, and working for an insurance company, we do, this is like our prime directive, is privacy. Give that person privacy. If they have a medical condition that people know about, that's great. But if they have a medical condition they don't want people to know about, they deserve that kind of privacy. So we kind of block off the area to ensure that happens. Again, if you have any questions, please let Raelene know at randerson@delta.org. We're happy to share information. One thing Raelene and I have learned over more years than we want to admit to is that in safety, in emergency, in crisis, you share the information with everybody and anybody. Because if we can save a life even outside our organization, then we've done our job. And Raelene and I have committed our whole adult lives to doing that. So we thank you, and I'll turn it back over to Raelene.
Thanks, everyone. Again, if you want any questions answered, please reach out and we'll be sure to get back to you. Thank you.